I guess it proves we're all gullible.
I'm not even going to comment.
But seriously, preventive health care. Preventive health care is what it's all about. And today we have Dr. Ken So, who is actually going to be here with us, and Stephanie Bryant's going to talk to him about cardiac preventive health care and cardiac health in men coming up.
Right, and Meredith Mitchell has not only our forecast, but a preview of her Weather 101 segment, which is coming up next. Meredith. Heart disease is a leading men's health threat. You can take charge of heart health by making healthier lifestyle choices. Stephanie Bryant tells us how in tonight's Healthy Difference for Men. Steph? Men can protect and strengthen their hearts by making a few choices that can ultimately save their lives. UAMS's Dr. Ken So joins me to talk about how men can have better cardiac health and help prevent heart attacks. Thanks for joining me.
Thank you for having me here.
Well, how can men strengthen their hearts?
Well, there are a couple of points, very important points that men always have to remember. And the first one that I would like to emphasize is that if they're a smoker, then this is the best time that they have to quit smoking, because smoking is #1 risk factor for having heart disease. And if they have other medical conditions like elevated blood pressure or diabetes, they have to go to their family doctor, once every year or once every 6 months to have their other health checked. If they have very unbalanced diet, and that's another thing that they have to always have in mind.
Yeah, I was going to ask, talk about the role of nutrition and exercise, how it can help men live longer and healthier lives.
Right. A lot of recent clinical studies and statistics indicate that men tend to have a lot of more vigorous exercise than other women would do. So that's something that, you always have to continue on. If you are not eating a lot of, fibers, if you're not taking multivitamin tablets, that's something that, you have to make a habit of.
Okay, so taking a vitamin, eating healthier, and definitely
and doing exercise, yeah.
Well, what are some of the symptoms that are associated with heart attacks that may be different from women?
Yeah, that's true. Women tend to come with very mild discomfort in the chest and also other associated symptoms like nausea, vomiting, and they can also have some neck pain, jaw pain. Whereas men, they typically come in with very severe heart pains right in the middle of the chest or towards a little bit of a left. And the quality of the symptom is very intense. It's squeezing and a lot of pressure building up. So that's the difference.
And talk about why it is such a serious thing for men to make sure that they do strengthen their heart.
Right, because after this heart attack happens, there are other health issues, always stumble, and what happens is that their heart is not pumping enough blood volume to supply their kidneys or to their brains, so they're, in the long run, they can have some kidney issues, and they can have other, blood supply issues in the rest of the body system as well. So this is very important to keep their heart as healthy as possible.
All right, thanks so much, Dr. So. Well, Wes Moore joins us now with a look at sports. Wes?
Coming up next, we'll